following broadcast on cancer in honor of National Cancer Week. We will discuss the dangers and treatments of cancers that are still taking the lives of millions of citizens.
We will start off the week by talking about pancreatic cancer. Pancreatic cancer is a deadly cancer with many unknowns and an alarmingly high death rate for such a common disease. It affects the lives of millions around the world, and tonight you will be hearing about the groundbreaking treatment from not only a doctor, but also a patient going through a clinical trial.
Now we will go over to our correspondent Michael, who is interviewing a doctor at Harvard University, who is an expert about pancreatic cancer, who will talk about the statistics and procedures for the diagnosis and treatment of pancreatic cancer.
Thanks, David. I'm here with Dr. Hyuk-in Lim at Harvard Medical Center to discuss the dangers and facts about this terrible cancer. So, Dr. Lim, why is pancreatic cancer so deadly and the chance of survival so low?
Pancreatic cancer has a very low percentage of survival because of the late diagnosis, which is caused by the asymptomatic nature of the disease. At the time of diagnosis, over 80% of pancreatic tumors have already metastasized.
Could you explain that a little bit more?
Metastasis is when a tumor spreads to other organs because it draws blood vessels to the site through a process called angiogenesis.
Just how deadly is pancreatic cancer?
Metastasis significantly complicates pancreatic cancer because it is in multiple locations. Often, chemotherapy is used to treat metastatic tumors. Since pancreatic cancer is so hard to diagnose early, treatment is often unsuccessful. The 1-year survival rate is 25%, while the 5-year survival rate is a mere 6%.
I'm aware that there are many types of pancreatic cancer. What are the different types and which makes each of them unique?
The two main categories of pancreatic cancer are exocrine and endocrine. Exocrine affects cells that create digestive enzymes, and endocrine affects islet cells that produce hormones such as insulin and glucagon.
What different risks do each of these cancers have?
The most common type of pancreatic cancer is adenocarcinoma, which is exocrine. It makes up around 90% of all pancreatic cancers. Endocrine tumors tend to grow more slowly than exocrine tumors, but they are still very deadly. In endocrine tumors, there are two different types of endocrine tumors, functional and non-functional. The functionals are usually benign, but the non-functionals are cancerous 90% of the time.
What treatments are currently being used by medical professionals to treat and hopefully cure this terrible disease?
There are 5 treatment options for pancreatic cancer patients, even though most patients are too far along in the disease to be treated when they are diagnosed.
There's obviously chemotherapy and radiation therapy, but what other procedures can be used to help patients?
There is surgery, most commonly the Whipple procedure. It is a surgical procedure in which different parts of the organ system are removed, but enough of the pancreas is left to produce digestive juices and insulin. There is also chemoradiation, a combination of chemotherapy and radiation treatments. And the most effective is targeted therapy, which is a slightly newer approach that pinpoints certain receptors more commonly found in cancer cells than in normal cells.
I understand that most clinical trials are linked to these newer targeted therapies.
Yes, they are, and we have many patients who have enjoyed increased longevity.
Thank you, Dr. Lim. Now we're going back to the studio to hear a testimonial from a cancer patient who has lived far past his expected lifespan because of a groundbreaking new technology.
Thank you for your time. I'm here with a cancer patient whose prognosis is looking strong due to new targeted therapy.
Hello, my name is Miguel, and I have a rare form of pancreatic neuroendocrine cancer for almost 14 months with no progression of the tumor. I'm not entirely sure of the side effects as of yet, but I am sure that this drug has helped prolong my life far past the expected period of progression-free survival.
Do you know the details of the drug and how it works?
Of course I do. It's the drug that is saving my life. It's called sunitinib, and it is the first effective drug that has been clinically successful. Although the long-term success of sunitinib is unknown, I am satisfied with the results so far. I'm confident that this drug is what slowed down the progression of my tumor.
Have any of your family members had cancer before?
Yes, believe it or not, my cousin also has pancreatic cancer. She has pancreatic adenocarcinoma, the most common type of pancreatic cancer. I believe this is due to the fact that pancreatic cancer tends to run in a family. Unlike breast cancer, the specific gene that is passed on is not known.
Has your cousin undergone clinical trial like you have?
My cousin receives chemotherapy after the surgery on a cancerous tumor. I believe the name of the specific drug was called gemcitabine. Although the drug is successful in preventing a recurrence, her prognosis was poor. However, she is still fighting strongly.
Thank you for your time. My prayers go out to you and your cousin.
It was my pleasure. Thanks for having me. That was a touching story that really encapsulated the horrors of pancreatic cancer.
Indeed it was, Mike. Although there are not many successful drugs today, stories like that of Miguel show promise for the future.
That's all for tonight, folks. Tomorrow night we will be talking about breast cancer.